An ovariohysterectomy, or spay procedure as it is often called, is a commonly performed surgery that offers many significant benefits to your pet. Because this procedure removes the primary reproductive organs, its most obvious benefit is the elimination of your pet's reproductive capabilities. This greatly benefits the overwhelming problem of pet overpopulation. Other benefits include the eliminating of the discharge associated with the estrus or heat cycle, which occurs every 7 to 8 months in dogs, and the prevention of irritating behavioral habits that are seen with unspayed pets. One of the less obvious but most important implications is the long-lasting health benefits for an animal that has been surgically spayed. Unaltered females are always at risk for a uterine infection called a pyometra, which can quickly become a life-threatening infection. Females who have been spayed also have fewer incidences of certain cancers. For these many reasons, spaying your pet is one of the most loving things you can do for them. Although this procedure can be performed earlier, the optimum age for spaying is between 5 and 7 months of age. Animals have a more developed immune system at this age and have normally completed their vaccination series. By spaying your dog or cat at this age, you'll avoid the first heat cycle, which typically occurs between 10 and 14 months of age. Pets who are spayed beyond 7 or 8 months of age run the risk of pregnancy or may be in estrus when presented for surgery. Being in season or pregnant can increase the risk of complications during surgery. You may have heard a myth that says spaying a pet makes the animal fat and lazy. Spaying can cause a reduction in the body's metabolic rate, and as a result, it may be necessary to reduce the amount of food offered if a pet begins to put on extra weight. However, this procedure will not cause a marked reduction in the daily activity level of a pet or change the basic personality of a dog or cat. Another misbelief is that it is necessary to delay the spay after a female has had her first heat or has bred once. This is an old wives' tale, and it is not necessary to delay spaying your dog for these reasons. Many owners want their children to experience the miracle of birth by breeding their pets. This experience should be weighed with the fact that allowing just one breeding to occur can ultimately lead to the production of hundreds of puppies or kittens. If you make the decision to allow your dog or cat to have a litter, be sure to have her spayed shortly after the puppies or kittens are weaned. Now that you are better informed and better understand the many benefits of spaying your pet, let's follow an owner and her dog through this procedure.
Good morning, Mrs. Jones. How are you this morning?
Doing fine. How about you?
Good. You have Sadie to be spayed. Hi, Sadie.
Yes, Sadie came in to be
All
spayed
ready?
today.
Okay.
The process actually begins the evening before, as the dog or cat will need to have food and water restricted. It is appropriate for the animal to have food until 8 p.m. and water until 12 a.m. the night before this surgery. Through the remainder of the night and the following morning, no food or water should be given. If your pet takes daily medications, ask your veterinarian if they should take their medication the morning prior to surgery. Your veterinarian will ask you to have your pet at the veterinary hospital at a specific time. In addition to a thorough physical exam, there may be tests your veterinarian feels are important to run before placing your pet under anesthesia. These tests help the doctor to evaluate your dog or cat's internal health and helps to predict how she will handle the anesthetic. Various blood tests, an EKG to monitor your pet's heart, blood pressure evaluation, and other tests may be recommended depending on the individual patient. The tests performed are dictated by your pet's age and general health. The information these tests provide your veterinarian may influence the anesthetic protocol chosen or help the doctor decide if the surgery should be postponed to allow for the resolution of any abnormalities. Your veterinarian or the veterinary staff will discuss their recommendations with you prior to the surgery should they be indicated. Your veterinarian may place an intravenous catheter into your pet to maintain fluid balance for the administration of emergency drugs during surgery. The spay procedure involves placing the patient under general anesthesia, meaning your pet will be fully unconscious. This is a major abdominal surgery performed under sterile operating conditions. An incision is made into the abdominal cavity, and the surgeon removes the ovaries and the uterus. Great care and training by the veterinary staff and multiple monitoring techniques used during the surgery keep the surgeon and surgical nurses constantly aware of your pet's status. Once the ovaries and uterus have been removed, The outer layer of skin may be closed using sutures that are external or sutures that are placed under the skin and are not visible. If external sutures are used, they will need to be removed 10 to 14 days following surgery. As the patient wakes up from anesthesia, they are usually experiencing minimal discomfort because of the anesthetic drugs your veterinarian has selected. Your veterinarian may prescribe and send home medication which will help relieve any pain and discomfort.
Hello.
Hello, how are you?
Doing great.
Good. Sadie did very well today. Her spay went well. She did just fine under anesthesia. And she's ready to go home today. And she'll just need to have some decreased activity for the next 5 days or so. Just no wrestling with the other dogs at home. Keeping her kind of quiet. She's got some pain medications to go home with, but no antibiotics. And she can have her sutures taken out in about a week to 10 days.
Can she eat tonight?
She can't eat tonight.
Great.
That's fine.
Good deal.
Good deal. Well, it was good to see both of you.
Thank you, Dr.
Take care.
Arnold.
Bye-bye.
Appreciate it.
Bye-bye, Sadie.
See ya.
When the pet returns home, it will be important to minimize her attempts to lick or chew the suture area. Some pets may require the use of a protective collar, called an Elizabethan collar, to ensure that this does not occur. The surgical site should be kept dry, no swimming or bathing until the sutures are removed. It is also important that your pet's activity be restricted following her spay. Rough play, running, climbing, and jumping should be discouraged as much as possible. Daily monitoring of the surgical site is also important, and your veterinarian may recommend that you clean the area with hydrogen peroxide. If redness, swelling, or any discharge occurs, you will need to contact your veterinarian. In most cases, our pets bounce back from this surgical procedure much quicker than we might expect. Within days, they are back to their same cute selves. Deciding to surgically alter a pet is truly an act of love and kindness that will benefit your friend for years to come.